Today we have back with us again the people behind Bare Bones Broth. They are Kate and Ryan. Visit them online, barebonesbroth.com, where right now through October 1st you can use a coupon code LLVLC at checkout to get $5 off your order. But Ryan, today we want to know all about what the cooking benefits of bone broth versus stock is.
That's a great question. We usually use the term bone broth to differentiate what is traditionally made by simmering bones and joints of animals over the period of 24 to 48 hours from a stock, which is more like 6 to 8 hours. And the difference is that it contains an extreme amount of gelatin, like 12 grams per cup. So when you're cooking with it, when you're making sauces and soups and stews, and you're reducing it down and you're getting all that gelatin into your food, which helps aid in digestion. And so its versatility and being able to include it in all of those dishes really can step up the nutritional benefits of every single dish that you make.
Oh, and if it had no nutritional benefits, I would still do it just for the taste that all the bone broth adds to all your food. So if you're not already cooking with bone broth, people, head on over right now to barebonesbroth.com, and again, use that coupon code LLVLC at checkout to get $5 off your order. Bare Bones Broth. Coming up in episode 979, Dr. Will Cole.
It's the Livin' La Vida Low Carb Show with Jimmy Moore. And now,
welcome back to the Livin' La Vida Low Carb Show with Jimmy Moore. Today, I'm very privileged to welcome to the podcast a guy I actually saw and met in person at the Paleo FX conference earlier this year. He is Dr. Will Cole, and he basically has been out there a whole lot of time doing functional medicine. And, we're really trying to push people to go find functional medicine physicians that are out there really doing great work. He specifically specializes in clinically investigating underlying factors and customizing health programs for various chronic conditions, including thyroid issues, autoimmune problems, hormonal dysfunctions, digestive and brain disorders, and he does all that on a daily basis, seeing patients. He's got a website, drwillcole.com. That's drwillcole.com. Will, welcome to the show.
Thanks for having me, Jimmy.
Yeah, man, you're one of those unique people that's been doing your thing for a little while and may not be as well known in the community, and most certainly not in my community, the low carb community. So why don't you kind of tell us where you came from and how you got interested in health and how it relates to all that you're doing with these patients?
Yeah, so I'm based in Pittsburgh, Pennsylvania, and we see patients here locally in Pittsburgh as well as nationally and internationally via webcam and phone consultations through our virtual functional medicine practice. But my background is from Southern California University of Health Sciences in Los Angeles. As you mentioned, my postdoctorate is in functional medicine, clinical nutrition, and I'm one of MindBodyGreen.com's health wellness contributors and experts, write them for years. I have a passion for helping people with chronic and autoimmune conditions, and I'm excited to talk with you today about functional medicine.
Yeah, we're going to get into a whole lot of rapid fire topics here in a minute, but so your interest in nutrition, a lot of times when you start going through traditional channels, it tends to point you in the calorie restriction, the fat restriction, eating more healthy whole grains, but you kind of buck that a little bit, and I see a lot of this happening in the functional medicine world, that a lot are kind of taking a little more of the naturopath route to learning, kind of going on your own. Is that what happened for you?
Yeah, I mean, I think that just seeing the need and seeing people in my family really going through a lot of chronic problems and autoimmune problems. I mean, there's not a family out there that's not touched by these issues.
Right.
And seeing a real gap in the standard model of care where they go for years of their life just on these medications where nothing that's really changing but their prescription list, and they're just getting sicker and sicker right before our eyes. And it may even be ourselves, and really just trying to find an option and seeking things that really started with my family. It's just how do I help them?
Yeah.
Really led to my professional desire to kind of fill that gap in for people compared to the standard model of care.
Well, and the sad thing is most people have an expectation that if things go wrong, the very first place that they turn is to medications. They don't think, oh, well, maybe there's some kind of nutrient deficiency or nutritional answer to this problem I have. No, just give me the pill, doc.
Yeah, exactly. They don't. I mean, there's a certain level of people just not asking questions, and it comes from a good intentioned place, I think. I mean,
right.
they're trusting their doctor, and they just don't realize that their doctor is only trained to diagnose the disease and match it with the corresponding drug.
Yeah.
They don't have any hours of clinical nutrition training unless they seek it themselves.
Right.
It's not given in school, so they're kind of going for their doctor for something they're not even trained for, and only that trained for that one thing, which is pharmacology. And like we say all the time, I mean, nobody is sick from a pharmaceutical deficiency. Nobody's sick from a lack of medications in their body. Right. And they're not going to medicate themselves into health one day. They're going to be on these medications forever unless they do something different compared to what they have been doing.
Yeah, I'm going to shout it from the mountaintop until I'm out of breath. Physicians don't know a darn thing about nutrition. They are taught in physiological and pharmacological, and outside of that, they really have no expertise. And yet all the things that we're about to talk about with you and how you handle patients, it's all about nutrition and lifestyle.
Yeah, I mean, exactly. I mean, our body is alive because of biochemistry. And just like Hippocrates, that food be thy medicine and medicine thy food. That should be our first course of treatment is going to be looking at those things. I mean, later on, if someone needs a medication and where it fits the bill of being the most effective option for them that causes them, the least amount of side effects, then a medication may be okay for those type of circumstances, but they're widely overprescribed and they have lots of side effects. We need to look at more logical solutions that are sustainable for health in the human body.
The last ditch effort, not the first line of defense.
Exactly.
Yeah. So tell us some of the other differences. We've heard, that mainstream medicine tends to be pharmacological and physiological. But what are some of the other differences between mainstream medicine and a functional medicine approach like you do?
Yeah, so that's a good question. I think that I would categorize the differences between mainstream medicine and functional medicine in three different ways. Number one is that we interpret the labs that are run currently, the ones you guys have from your PCP or endocrinologist or another specialist. We interpret those labs differently in functional medicine. Yeah. Because we know on those labs you have that reference range where they say from X to Y, that's where your lab should be, and anything outside of that range is high or low. It's typically a bold font. You have a problem. But we kind of have to ask that question, where do we get that reference range? It's based on a bell curve, statistical average of the population of that lab.
Sick people.
So, sick people, right? Who are the people that typically go to labs? They're sick people. So it's not looking at optimal health, vitality, living the longest without complications and side effects. It's just looking at a population of sick people, which people will notice that reference range will typically vary from lab to lab depending on the lab that they go to, other than, as you know, cholesterol and vitamin D.
Right.
So what we're looking at in functional medicine is a much thinner, narrower range of what signifies optimal health, where your body is functioning the best, hence where we get our word functional medicine. Your body's systems are functioning the best in that thinner functional range. So number one would be the interpretation of the labs we do differently. Number two would be the amount of labs that we run in functional medicine. We look at more of these underlying functional systemic issues that give rise to chronic and autoimmune conditions.
Yep.
And the reason why they're not run in mainstream medicine is I don't want to be a conspiracy. It's not a conspiracy. It's just it doesn't change the treatment. You're going to get whatever medication you're on with just the basic labs. So it's superfluous lab testing if the end result is still that pharmaceutical drug.
That's right.
So it's not negligence. Their only labs they need to run are the ones they're running to give the pharmaceutical. But for you to find out, okay, why am I going through what I'm going through, and what's the underlying issue of why I'm sick in the first place? Why am I on this medication in the first place? We need to run these labs. So looking at the microbiome, looking at hormonal pathways, looking at inflammation cascades, these are really important factors for people that are struggling with health problems. And number 3, I would say we do differently in functional medicine would be we take into account biological variability, meaning we're all differently. We're all created differently. We're all designed differently. And you could have anything under the sun, whether it's a pharmaceutical or some natural thing that you read online. What works for one person may not be right for you. So we need to really take a really detailed look at your biochemistry, what suits you, and then clinically monitor you and coach you and give you that in-depth one-on-one coaching and accountability that people need versus that 5-minute consultation with your doctor and see you in 6 months.
You mean there's no one diet that fits all, Will? Say it ain't so.
No, I think someone would have made a lot of money if that were true. But
well,
yeah,
and
no,
the government seems to think there is, because they keep pushing this same tune that every single 5 years, do the dietary guidelines. It's exactly the same thing, with slight variations here and there. It seems like, the definition of insanity is doing the same thing over and over again, expecting a different result. And we've been insane about nutrition for a very long time.
I completely agree. And it's amazing, even today, the misinformation that's still out there. I mean, I'm maybe because we're immersed in this that I get caught up into this is just common knowledge now. Yeah. But you go talk to somebody outside, they still believe things that they're still talking about this misinformation out there.
It's a parallel universe, isn't it?
Exactly. Well said.
Yeah. So you mentioned that there are better ranges and optimal ranges for these various labs. Is there a place where people can find what those optimal ranges are, or is that where somebody like you comes in and says, well, we kind of have to customize it to your specific situation?
Yeah, I think that there definitely are great resources online. I myself, on drwillcole.com, I have e-guides out there that I send out to my subscribers with the functional ranges. So it's free information. It's not nothing that's, should be just, it's freely accessible out there. So for a thyroid panel, just beyond the TSH, we do a full functional thyroid panel and other hormonal panels and blood chemistry analysis. Yeah, we have all of that on our website. And I'm sure there's other functional medicine practitioners that have that information freely available as well.
Yeah, we've had Dr. Amy Myers on here before, who's another great functional medicine doctor. And
I love her. She's great.
Yeah, lots of you guys are doing a really great job. Just need to clone you because there's not enough of you out there doing what you're doing. So let's get into one of the labs that you're pretty adept at, and you just mentioned it, and that is the thyroid labs. And as you stated very clearly, most doctors are only running, specific tests that they think tell them something, the TSH, and think that gives them the be-all, end-all about your thyroid health, but there's so much more involved. Can you kind of get into this thyroid issue?
Yeah, absolutely. I mean, it's thyroid symptoms and thyroid problems are very, very common in the United States, and it's widely underdiagnosed. There's 20 million people affected. 1 in 8 women will have a thyroid problem in her life. I mean, this is very common. And the standard model of care, what that paradigm kind of looks at, is primarily TSH, which is your thyroid stimulating hormone, which is not actually a thyroid hormone. It's a brain hormone. It's a pituitary hormone. Yeah. And it's basically your brain speaking to your thyroid. So they're looking, again, at that reference range. It's on the lab, and it's typically of sick people, right? So it's looking at 0.45 to 4.5. That's the typical range of the thyroid stimulating hormone.
That's wide.
And it's a huge range. And what we are finding in the literature is when you take out people with known hypothyroidism out of the equation, out of that population of sick people, it's actually quite smaller range. So the functional range is somewhere between 0.45 to 2.5. And research shows that if you have a TSH 2.5 to 3.5, which is well within that normal quote unquote reference range, you're at quite a increased risk of heart attack and stroke. I think it's 60 risk of dying from a heart attack and stroke by some reports. So it's this really important beyond just simple lab. It's just direct implications to people's health and how long they're living and the quality of life that they have. So we have to interpret that TSH differently, because you could have a functionally high TSH or a hypothyroidism issue that goes undiagnosed for years because you're still within that huge range. And then that's such an incomplete view of thyroid physiology to just run one lab and give you Synthroid or levothyroxine if it's outside of that range. We have to look at a full functional medicine analysis of the thyroid, which is looking at all aspects of thyroid physiology. So we have to look at T4, which is the inactive form of the thyroid hormone. It has some use up in the brain cells, but that T4 primarily has to be converted into T3, which is that biologically active, let's use it in the cell of the body, and every cell of your body has a thyroid receptor site, and no other hormone other than vitamin D can claim that level of importance for human physiology. So it affects everything in your body. And so that T4 has to be converted into T3. So we look at the conversion of T4 to T3, which primarily happens in the liver and around 20% in your gut, in the microbiome. And then we have to look at the free form of the hormone and the protein bound of the hormones, because you have what's called a thyroid binding globulin. Basically, every hormone of your body gets transported on these little protein carriers. And if you have an excess of those protein carriers because of other hormonal problems, that can affect the amount of thyroid hormone that's getting into the cell. And then cell of looking at thyroid resistance, which is similar to insulin resistance or leptin resistance, that your thyroid is working fine, it's just not getting into the cell because of either overconversion or systemic inflammation, whatever the case may be. So there's a lot of different issues, whether it's conversion issues or binding globulin issues or resistance issues, or brain issues. You could have a pituitary hypofunction, which basically the brain's not communicating with the thyroid. You could have a normal TSH just because of a brain dysfunction. So we have to look at all the different aspects, all the different underlying issues that give rise to these low thyroid symptoms, which could be anything and everything because it affects every cell of your body.
Well, and it makes me wonder how much of our cultural bend towards being in a hypocaloric state, because lowering your calories is a prudent way to diet and be healthy. I wonder how much of that is contributing to this rise in the amount of thyroid issues that people are dealing with.
I think that it does play a huge part in it, actually, because people go years of their life just adding to these lists of dietings and low-calorie things and fad diets, crash diets. It's messing people's hormones up, and they need to just dump dieting and start healing their body with food medicine, heal with meals instead of medicine, and the body can start making these hormones again and converting them again and getting them into the cells again. The body's just in this starvation mode, and chronic starvation is going to mess up your hormones. So I completely agree with that.
Have you tried the wide array of products from Quest Nutrition? Visit them at questnutrition.com, and you can see the famous Quest bars, as well as some really great products that are out there, the peanut butter cups that are available, the new Quest protein chips, and the Quest protein powder. They have a full array of products that are really great, and healthy eating should be fun. You deserve delicious, real food that's actually good for you. Again, the company is called Quest Nutrition. Visit them online at questnutrition.com. My wife, Christine, actually had many years where she underate, and she was teeny tiny when I met her, Will. She was like 90 pounds in her early 20s, and now she's got Hashimotos.
Yeah, I mean, that's something that we need to talk about. I mean, it's affected your wife, and it affects a lot of people. I mean, the Endocrine Society says upwards of 90% of low thyroid function in the United States is autoimmune in nature. Yeah. The most common one is Hashimoto's disease, which is this autoimmune thyroiditis. So it's very common. And again, we have to look at that functional issues. That is truly not a thyroid problem. It's the autoimmune disease attacking the thyroid. So the thyroid is not the problem, it's the victim of the immune system attacking it. So sorry for your wife, but there's so much things you can do naturally with functional medicine to dampen that autoimmune attack against the thyroid and modulate the immune system and start regaining your health back. And you can live a healthy, vibrant life with an autoimmune condition, but you're going to have to live and breathe according to your biochemistry and what works for you.
Yeah, and for her, she's also dealing with another autoimmune issue. Psoriasis just drives her crazy, burning in the back of her head. So yeah, she's trying to deal with it the best she can, and is going to be seeing her doctor about it. But he's only going to recommend her to see a dermatologist who may or may not know how to deal with this.
Yeah, I mean, I think for autoimmune conditions, and just to touch on that real fast, someone with one autoimmune condition is at a 50 to 70% risk of getting, God forbid, another autoimmune condition.
Yeah.
So most of our patients have polyautoimmunity. They have multiple autoimmune conditions by the time they've burnt out every option in mainstream medicine, and finally functional medicine is really their only option. And to be honest with you, I know that I'm biased, but I think functional medicine is one of the only options for someone with an autoimmune condition, because they don't really have any options for you in mainstream medicine. They give you steroids, they'll give you immunosuppressants, maybe a pain pill. That's about it. I think that the idea of modulating the immune system or dampening the inflammation is just like, it's not in their paradigm. So to start looking at the immunology of these thyroid problems and autoimmunity at large is hugely important. Yeah, so someone with psoriasis, or, I mean, we see a lot of patients with lupus and MS and Parkinson's. We can go on and on about it. There's over 100 autoimmune diseases and another 40 with some sort of autoimmune component to them. This is a huge problem. And again, it trickles down to thyroid physiology, because the majority in the United States, at least, are somewhere on that autoimmune spectrum.
So how do they find you, Will? They don't just type in find a doctor that will fix me.com. You know, they have to find you somehow. How are they finding you and other functional medicine practitioners like you?
So myself, it's drwillcole.com, which is drwillcole.com. And you can go through IFM as well. They have a directory, and Functional Medicine University, they have a directory. Then there's, good sources too in the sort of primal paleo world too. They have the Physicians Network, Paleo Physicians Network, as well as, Primal Docs as well. And great resources for doctors that are thinking outside of that paradigm, that are really trying to get people next level options based on themselves.
Great. So let's move on to another disease that is one that you see quite a bit, and it's actually on the rise. I think I saw a statistic that by the year like 2040 or 2045, something like that, we're going to have such a huge epidemic that most of the population is going to have this disease, and I'm talking about diabetes. And this is one that's kind of near and dear to this show, since the Livin' La Vida Low Carb show. Low carb seems to be a way to deal with diabetes that is pretty much by the mainstream being ignored.
Yeah, I think, I know the statistic you're talking about. I think the number that I remember is about by the year 2020, 50% of the United States will be at risk for diabetes, which is
even
only
sooner. Yeah,
5 years away. I mean, 50%. So this is growing by leaps and bounds. It's tripled in the past decade. We used to call it adult onset diabetes, but your audience knows what's going on now is that kids are being diagnosed with this. 1 out of 2 kids born after the year 2000, they're at risk for these problems. This is a problem. And again, this is the same model where they're just blood sugar. They just wait till they're sick enough, give them metformin, give them another medication, and they go on for years of their life just getting more and more medications to shove that blood sugar down artificially until finally there's nothing left out there but insulin. So they're on Humalog or Novolog or Humulin or Levemir or Lantus.
Expensive too.
Expensive, right? So they're hundreds and hundreds and hundreds of dollars in debt to these medications that they'll never get off of doing the same thing they have been doing. But the reality is that research shows that over 90% of type 2 diabetics are able to reverse their problems and prevent their problems. This is not some sort of small issue where people are getting success. The overwhelming majority of type 2 diabetics are able to reverse this disease. And I would say 100% are able to completely improve their health and decrease their risk factors and complications, and it's not going to be from another medication.
Yeah. How do we miss the food-like disease agent contributor? That's what I call junk food, by the way. Disease agent, they're causing all of this to happen And yet nobody sees that, or at least if they do see it, they're turning a blind eye to it.
Yeah, I see that. And I've seen a shift over the last couple years with diabetes, at least, because I believe when in 2008, when I started really out there in functional medicine, it was like it was blasphemy to say that diabetes could be reversed and that food had something to do with your health. I mean, it was different. And I feel like today, people like Mark Hyman that have a louder voice and a bigger voice, I'm so thankful for that. Yeah. But I feel it's on people's radar as far as like, look, these things are correlated. There's something you can do. I mean, but at the same time, it's that dichotomy. And I just got a comment from someone on our Facebook page yesterday, and she was saying, oh, my diabetic educator said I needed all these carbs per meal. And, how could you just, I mean, what are you supposed to do if you just eat fat? So, I mean, we have to
enjoy life.
Yeah. There's so much education that needs to be happening. And I feel like when people know better, at least they should do better. And I feel like a lot of us just need to get out there and educate people in a loving way and in a patient way, because they've been told from they were little kids that this is the way you should eat and this is the balanced meal.
Yeah. Now, even type 1 diabetics also, sometimes we kind of throw diabetes out there as if it's just one thing, but type 1 is a far different one than type 2 diabetes. Can you kind of get into why type 1 is an autoimmune issue and isn't necessarily brought on by, excess sugar consumption? It didn't, these people didn't bring it on themselves like people with type 2 tend to do.
Yeah, so I think that the type 1 diabetes, we talked about autoimmune diseases a little bit ago. This is another one. So as Hashimoto's is an autoimmune attack against the thyroid, type 1 diabetes is an autoimmune attack against the pancreas. So this is, again, there's a genetic component to autoimmunity typically. Typically, it's, most autoimmune conditions are X chromosome linked. More women get autoimmune conditions than men do for most of them. And there's some epigenetic trigger. So to say that it doesn't have an environmental factor isn't true, but there is more of a genetic predisposition for autoimmunity. And I would say that these lifestyle things, the toxins we're exposed to, or the foods we're eating or not eating, the stress levels, are we smoking or drinking too much alcohol, all of these epigenetic environmental factors are constantly and dynamically instructing our genes how to be expressed. Yep. So for any autoimmune disease, whether it's type 1 diabetes or rheumatoid arthritis or Crohn's or celiac, whatever the case may be, there's some straw that broke the camel's back that caused that autoimmune response. So someone can have juvenile onset type 1 diabetes, and that's what's classically known as. But there's a whole other phenomenon now that's known as type 1.5 diabetes, or LADA, or it stands for late autoimmune diabetes of adulthood, which is a hybrid. It's part chronic degenerative inflammatory, like a typical like high triglycerides, metabolic syndrome type 2 looking on labs, but it's part type 1 where they have raised antibodies against the pancreatic cells, and you run a C-peptide basically looking at how much insulin their body's naturally making, and it's nothing. So you have this hybrid autoimmune chronic degenerative problem. So type 1s and type 1.5s are, for all intents and purposes, not able to get off of insulin like a type 2 would be able to.
So there's no beta cell function in these 1.5s.
Yeah, there's no or little function.
Gotcha.
And there's no literature to say that there's going to be regeneration of those beta cells. I think that you can dramatically affect inflammation and decrease the amount of insulin that your body needs, and the way that you eat and the way that you function, and start healing these underlying autoimmune imbalances. Yep. But for all intents and purposes, they'll always be on some low levels of insulin. But what we need to do is decrease the risk factors and complications, which you have so much control on in your life, someone that's going through this.
Yeah. Now, what we've not talked about regarding any kind of diabetes is what are the labs that you look at, because when a typical patient goes to see their mainstream, PCP, they're going to say, oh, a 7.0 A1C is perfectly fine for you and keep up the great work. Whereas a functional medicine practitioner may look at that 7.0 and go, we have a lot of work left to be done.
Absolutely. So I think that what are good risk factors, what are good gauges for how your health is? I would say your labs are one of them, and then looking at the optimal range, and then look at your medication list. When you look at a 7.0 A1C, for example, like you said, what medications are you on to make it at 7.0 A1C?
Yeah.
Because where would you be hypothetically off of that medication? That's the true size of the disease, not where you shut it down with 5 medications. So we have to look at that too. So in functional medicine, we're not concerned with just the label of the disease. We're concerned with where does the risk factor happen. And as you know, and as your audience knows, A1C at 7 is increasing your risk factors. So we're not just concerned with managing this disease. And for your endocrinologist or PCP, I mean, it's all relativity. I mean, they're saying 7 is a success because they're saying, everyone else is at a 12 A1C.
Yep.
But the reality is your risk factors are there. You're more managed disease, but I'm not concerned with just managing a disease. I don't want you to have the disease. So let's reverse the disease, get healthy, decrease your risk factors. And that's A1C is going to be anything above, I'd say 5.6 is a problem.
Yeah.
And that's going to be off of medication, obviously. So a normal A1C is going to be in the low 5 range at least. And then obviously low triglycerides, which again, you know this well, is that triglycerides below 100 is where we want them in the functional medicine range.
Yep.
Anything above 100 is a problem, and typical lab reference range is 150. So we're looking at the blood sugar, and then with, I would say, more healthy ranges, not just the diseased range, the managed disease range, but we're also looking at the risk factors of the disease, which diabetes is the leading cause of heart attack and stroke in the United States. So we're looking at tests that I'm sure you've ran in the past and you've written about in your book as well, as a nuclear magnetic resonance, the NMR test, and we're looking at the VAP test. So we're looking at the subfractionation of the lipid particles, inflammatory proteins like C-reactive protein, homocysteine. These are important things to look at as a diabetic, whether it's type 2, type 1.5, or type 1, to know your cardiovascular risk factors, which we know people don't die from diabetes typically. They're dying from complications of it. So to know the risk factors there is important, and to use it as a baseline. So watch it improve as you start making these great lifestyle interventions and through functional medicine. And then we're also measuring the C-peptide, which we mentioned. So for every molecule of C-peptide, you get a molecule of insulin. So it's an indirect way for us to gauge how much insulin your body's producing on its own through the pancreatic function. And then we're running the insulin antibodies, which is seeing, are you having any autoimmune attack against the pancreas to kind of rule out that type 1.5 autoimmune diabetes.
Yeah. Yeah, people often, they'll test their blood sugar at home, and they'll, I'm in the good range, but they don't know what's happening with their insulin levels. So I love that you bring out that you're keeping an eye on that. And I think people should know where not just their fasting insulin level is, but what's happening postprandial. Are you getting huge spikes? Yeah, your blood sugar could stay in a really good range, but if you see all the insulin that's keeping it down in that range, it could tell the tale of what's going on inside of you.
Yeah, exactly. So we definitely want to keep in mind the amount of insulin that's used, and the amount of, even running fasting insulin is an important other lab that you want to look at, because we know what hyperinsulinemia can do. Excess insulin in the blood, it's a killer. So to have these levels at optimally healthy ranges, it's just never going to happen in mainstream medicine the way that it is now. So you're going to have to really kind of be your own clinical investigator, finding out these things for yourselves, and finding a qualified functional medicine practitioner to be that, be that coach, to be that clinical investigator with you, to take kind of the load off, so you can trust somebody that deals with this on a daily basis.
Yeah. His name is Dr. Will Cole. Check him out at his website. He makes it real easy, drwillcole.com. And if you go there, you can sign up for free ebooks, recipes, personal health tips, and more. If you like what you heard from Will today, please go check him out. And Will, thanks so much for joining us here today on the Livin' La Vida Low Carb Show.
Thanks so much, Jimmy.
Coming up next time on the Livin' La Vida Low Carb Show, we'll have guest host and fellow podcaster Sean Stevenson from the Model Health Show.
Visit our website at thelivinglowcarbshow.com/show notes. And email us anytime at llvlcshow@gmail.com. Thanks for listening.
Disc of light.